Hey guys, this is Dr. Sosnowski. I wanted to go ahead and go over your stool results with you that you did a couple of weeks ago, and wanted to just talk about what they mean and what we're going to do about them. So first off, when you look at your stool sample, we're looking at the expected or beneficial flora. All of these should be 3 to 4 plus in number. Any NG means no growth, or 1 plus or 2 plus is too little. Frequently, I see Bifidobacterium and Lactobacillus really low. And these are typically because these are the ones that glyphosate, or that Roundup that are all on all the non-organic foods, is killing these guys off in particular. One of the reasons why our guts are not working as well today as they would have years ago, as well as, of course, all the antibiotics and all the other stresses going on. We're also looking at our imbalanced flora, or the commensal flora. These are bacteria that should be in the gut, but there are just too many of them. They're overgrowing to make up for the lack of some of the other ones that are not here. And then we have the dysbiotic flora. The dysbiotic flora are those bacteria that are so overgrown that we actually need to kill them off. And these are still bacteria. They're also doing a yeast culture. So here the culture grew 2 bacteriums, this Geotrichum, as well as Saccharomyces boulardii, or Saccharomyces cerevisiae. This patient was actually taking a probiotic with Saccharomyces boulardii beforehand, and this is actually a beneficial yeast, so we don't particularly want to kill this one off. It's a good one to have around, but we've still got some Geotrichum here that we need to kill off, and so we'll be looking at this as we go forward. So my writing on here is my little summary. We'll kick back to this as we go through the stool sample here. So the next page of your test is going to be the diarrheal inducing agents. So these are bacteria that induce diarrhea typically, and viruses that do so. In this patient, all the testing was negative. This really wasn't what we were doing the stool culture for, so no surprise there that it was negative. The next page is a really important page because it looks at how digestion, inflammation, the immune system is working in the gut. So the first thing that we're looking for in digestion are, do you have enough elastase? Now, elastase is your pancreatic enzyme. We should see, our regular result that we should see is above 500. In this patient, their elastase is only 161, which is below the reference interval of at least 200. So this patient is not putting out enough pancreatic enzyme. That's not atypical. And I see commonly with the low elastase, I also see a low betaine, which is your stomach acid, and with that, a low gallbladder enzymes, or the bile salts that are low. So typically when I see the elastase low, I'll suggest that you take an enzyme mix called Panplex, which is betaine, elastase, and other pancreatic enzymes, as well as bile salts. And these are released in a time-release fashion. So the betaine is released in the stomach, and then the bile salts and the elastase are released in the small bowel, where they're normally released by their organs. There's no fat detected, so fat digestion is working okay. Carbohydrate digestion is generally working okay, although the elastase is helping to digest complex carbohydrates. I don't see that the carbohydrate digestion is actually very accurate most of the time. Inflammation is the next step we're checking. The lactoferrin and the calprotectin, if these guys are elevated beyond that 7.3 or 50, then you've got a much higher risk of inflammatory bowel disease going forward. So really important to look at those. In this client, the numbers are negative, so not much risk of inflammatory bowel disease going forward. Lysozyme is a white blood cell marker. So if the lysozyme is high, again, more inflammation in the gut. The immune system in the gut, we all know that 70% of our immune system this is one of our biggest sources of interaction with the outside world, is our gut. And that secretory IgA is what's protecting us. It's keeping the bad guys, it's the little soldiers in there that are keeping the bad guys out and the good guys in, and helping that balance. In this case, we want a range of between 30 and 275. If we're over 275, there's so much inflammation going on that our body has called in reinforcements for our soldiers, and they're out there fighting a big battle. If our number's below 30, then we've called in reinforcements, we've fought that big battle, we've killed off too many of our soldiers, and we got nothing left. We're losing. So either side is not particularly where we want to be, but typically below 30 is a really bad place to be. And we want to make sure that we're doing something to get our soldiers back up. If your IgA is low, I'm typically recommending some Saccharomyces boulardii. So this patient was already taking some of that, and maybe why her numbers are as good as they are at this point. If your inflammation in the gut is high, I typically recommend a powder that you can use as a shake every day, once a day, called Inflammacor. This is a mix of anti-inflammatory proteins and herbs that really decrease the inflammation in the gut. The short chain fatty acids are the food for the good bacteria. In general, these short chain fatty acids are vegetable fibers. That's why we have you eating vegetables till they're coming out of your ears, because it's really important to breed those good bacteria. When we're looking at total short chain fatty acids, we're looking at the total number as well as the butyrate as the two most important numbers that we're looking for. Now, this client has some low normal numbers, but they're still in the normal range. So we're doing okay with that. And we know we're going to be eating tons of vegetables, so we don't need to go overboard on prescribing more supplements for that. pH looks fairly normal, and there's no blood, and the stool consistency is normal. So that's all good. If pH is way below normal, it's typically telling me that things are going through too fast. So oftentimes that can be a parasite of some sort. It can be dairy allergy, can speed things through. Dairy allergy can also cause constipation very frequently. In this case, there is a sensitivity that we're given for the geotrichum to see what herbs it will respond to and if there's any antifungals or antibacterials that it will respond to. I typically don't use prescription drugs. I will use supplements, and I usually use a combination of 2 supplements to kill off a yeast or a bacteria, because I know that if it gets resistant to one, I've still got the other one to work. In this case, anything that hits the green is something that we could use. So we could use grapefruit seed extract, we could use the uva ursi, which is otherwise called bearberry, and caprylic acid. Any 2 of these 3 would be great. And in this case, I chose grapefruit seed extract and caprylic acid. So if we go back to the first page, that's my little summary of all the testing here. Sorry to hopefully not make you dizzy here. So my summary is that we've got dysbiosis, so abnormal ratios of good bacteria and not so good bacteria here. With a yeast, we've got no infectious agents, a low elastase, which means we need to start some Panplex. We've got the grapefruit seed and caprylic acid to kill off the yeast. There's a normal amount of the IgAs, the salivary IgAs. There's a normal amount of the short chain fatty acids, and the pH is normal. So the grapefruit seed and caprylic acid will work for the yeast, the Panplex will work for the low elastase, and then otherwise we'll use our normal GI healing protocol. And Dawn will talk about that when you get to the detox part of the program. So the only thing we're going to be starting right away is the digestive enzyme, the Panplex, because we want digestion to start happening immediately so that you can start absorbing more of what you're getting from your food.